The roles and responsibilities of the registered nurse. Today I'm going to talk to you about the roles and responsibilities of the registered nurse. There are 5 topics that I'm going to cover. There are recent changes and their impact, the Nursing and Midwifery Council, implications of the code, effective communication in a multidisciplinary healthcare setting, and finally the multidisciplinary approach. So I'll start by saying that a nurse has many roles and responsibilities. You are a caregiver, a counsellor, an educator, a communicator, a patient advocate, a leader, a researcher, and a collaborator. In the last 30 years, there have been many changes which have impacted the roles and responsibilities of the registered nurse. Those can be categorised into 7 categories: political, economic, social, technological and scientific, organisational, professionalism, and policy. Today I'm going to talk about political and economic changes. First of all, nurse education has greatly changed since something called Project 2000 was introduced in 1990 by the UKCC, now the NMC. This moved nurse education from apprenticeship routes and on-site training into universities, where nurses gain a professional status and a degree. When training used to be focused on disease and symptom management, nurses now apply critical analysis and reflection. Instead of being a pair of hands to deliver care, nurses now have an academic background. They are highly educated and they have a research-based professionalism with enhanced skills focusing on wider community care. Project 2000 was criticised due to its focus on education rather than practice in a clinical setting, and nurses are criticised for having the brains but not the empathy. Reforms were made to attract more people into the profession, so now you can get a nursing diploma rather than a degree, and there are also apprenticeship routes available where you can get paid whilst you are training. Another recent change is that if you wish to study mental health nursing, for example, you can specialise from day 1 of your course and you don't need to learn every aspect of nursing. The Patients' Charter reshaped structures and relationships within the NHS. Patients' rights and responsibilities were highlighted, and nurses were emphasised as advocates, which increased their autonomy and accountability. However, the Charter was criticised for increasing attacks on NHS staff due to expectations from patients and families. The Charter has more recently been replaced by the NHS Constitution for England in 2013. The new NHS Modern Dependable White Paper, introduced by Tony Blair, promised to modernise the NHS and deliver high-quality care for all who need it. It introduced primary care groups, which act as the front door to the NHS. Local health improvement programmes to ensure consistency, coordination and working together to improve health. Also NICE, the National Institute for Health and Care Excellence, which is a team of experts whose core purpose is to help practitioners and commissioners get the best care to patients fast while ensuring value for the taxpayer. Some changes in terms of funding and management since the 1990 NHS and Community Care Act. The Act made provisions to split the provision and commissioning, i.e. purchasing of healthcare. It marked the start of an internal market within the NHS with the creation of NHS trusts and changes to the way in which local authorities carried out their social care functions. GPs and district health authorities now have the freedom to choose where to purchase services. This has been met with scepticism because the NHS workers could now be seen to have a financial incentive when delivering care to patients. However, there is positive criticism about how hospitals and NHS services can now manage the delivery of care in a more cost-effective way. The impact on the roles and responsibilities of registered nurses is that they are now responsible for pooling data and identifying good practice. Another 2 important changes are the Health and Social Care Act 2012 and the Health and Care Act 2022, which have again been met with criticism. The Health and Social Care Act 2012 targeted increased demand and treatment costs. Clinical Care Commissioning Groups, or CCGs, replaced primary care trusts in 2013 and reshaped health services, empowering patients, clarifying clinical roles and responsibilities, and bringing greater accountability to all health professionals. Nurses assumed more specialist and leadership roles. The Nursing and Midwifery Council. The Nursing and Midwifery Council are the independent regulators of all nurses and midwives in the UK and nursing associates in England. They maintain the register. Their vision is safe, effective and kind nursing and midwifery practice that improves everyone's health and well-being. Their purpose is to promote and uphold high professional standards in nursing and midwifery, to protect the public, inspire public confidence and professional pride. They have three key roles that support their purpose. First, they regulate. They set standards for nursing and midwifery education and practice. They maintain the register of professionals, and they investigate when things go wrong. Second, they support. They support people to deliver their standards in practice so that people using their services can get the care they have the right to expect. They also help address challenges that the professions might be facing. Finally, they influence. They share data and insight, working with partners to influence wider health and social care issues to improve everyone's health and well-being. How does it shape the qualification that I'm doing? It starts with setting standards for nursing and midwifery practice that include setting standards of proficiency, which explain what you need to know and what you need to be able to do by the time you join the register. They also set the code. They also set standards for education programmes and quality assure our education. Their standards for student supervision and assessment, known as SSSA, are there to make sure you receive high quality learning, support and supervision during practice placements. Once I complete my education, I will be invited to join the register so I can practice. To ensure that all professionals keep their knowledge and skills up to date, they then require us to complete what they call revalidation. This takes place every 3 years and ensures that knowledge and skills are kept up to date. What do I have to do to remain on the register? I must follow the rules of the code and meet the standards of proficiency. How does it support nurses? New evidence and technology can improve people's care. The standards are updated to reflect new evidence and its impact on people, and my knowledge must also support these changes. They will always consider whether they need to regulate additional post-registration qualifications. The code, standards of proficiency, standards for education and training, and revalidation are the regulatory framework foundations of professional practice. They work to keep people safe. How will the NMC respond if people don't work to the standard that is expected of them? If any concerns are raised about an individual once they are on the register, then they should be generally dealt with by the employer. However, if it is a serious concern about someone's skills, behaviour, or what their right is to be on the register, then the NMC can get involved. The issues will go through what they call a fitness to practice process. Their role is not to punish people for things that have happened. They need to make sure that professionals meet the standards so they can deliver safe, kind, and effective care to the public. Therefore, they can remove people from the register if necessary. They do take wider contextual evidence into account when looking into questions around someone's practice. That way they can fully understand what has happened and they know how to keep people safe in the future. They also employ a learning culture. Their duty of candor guidance states that as a healthcare professional, you have a duty to be honest and open, and also if you believe a colleague or anyone else might be putting someone in your care or anyone else at risk, you should speak up and report your concerns straight away so you can encourage others to do the same, and you should encourage others to do the same. What is the role of mentors? Throughout an NMC approved programme, mentors and practice teachers who are on the local register will assess competence in practice and confirm that students are capable of safe and effective practice. What is the role of CPD? As part of your revalidation, you must undertake 35 hours of continuing professional development relevant to your scope of practice as a nurse, nursing associate or midwife over 3 years, prior to your revalidation date. This must include 20 hours of participatory learning. Implications of the code. The code sets common standards for conduct and behaviour for those on our register. It provides clear, consistent and positive messages to patients, service users and colleagues about what they can expect of those who provide nursing and midwifery care. The NMC can take action if those on the register fail to meet the standards of the code. In serious cases, that can mean removing them from the register. The code is a way of reinforcing professionalism. Through revalidation, nurses, midwives and nursing associates provide evidence of their continued ability to practice safely and effectively. It provides the focus for professional reflection. The code contains a series of statements that taken together signify what good practice means by nurses, midwives and nursing associates. It puts the interests of patients and service users first. It is safe, effective and promotes trust through professionalism. There are 4 main principles with specific standards attached to those principles. These have been simplified in the new revised code 2015, and they are: 1. Prioritise people. 2. Practice effectively. 3. Preserve safety. And 4. Promote professionalism and trust. How and why does the code impact nurses? It ensures that nurses are putting the needs of people they care for first, and that they are treated with respect and dignity. It ensures that the needs are properly assessed, monitored and attended to, and that any discriminatory attitudes are challenged. Nurses must assess need and deliver or advise treatment or give help, including preventative and rehabilitative, without too much delay and to the best of their ability. We need to do so on the best available evidence and best practice. Nurses are accountable for their decisions to delegate tasks and duties to other people. We must make sure that the other person is competent to do what you've asked them to do and fully understand the instructions that they are given. We must make sure that everyone we delegate to is adequately supervised and supported so that they can provide safe and compassionate care. Very importantly, we must confirm that the outcome of any task delegated to someone meets the required standard. Nurses must ensure that the public and patient safety are protected. Nurses must advise on, prescribe, supply, dispense and administer medications only if they have completed a further education in prescribing and it is recorded on the register. Nurses must be models of integrity and leadership for others to aspire to in order to build confidence and trust in the profession. Nurses must use all forms of communication responsibly and respect the rights to privacy of others at all times. All complaints must be used as an opportunity for reflection and learning to improve our practice. Methods for the NMC to tell all nurses how they should work. The NMC will tell nurses how they should work by instructing them to read the code. The need for effective communication in a multidisciplinary healthcare setting. The Social Care Institute for Excellence states that integrated care requires professionals and practitioners from across different sectors to work together around the needs of people, their families and their communities. Teams which bring together relevant professionals and practitioners can be an effective means to encourage better coordination of their work. Multidisciplinary teams, or MDTs, have long been deployed within services for individuals with complex needs, such as young people who have offended, people diagnosed with cancer, people with severe mental health issues, and people who are at risk of abuse or neglect. In more recent times, they are also being deployed for more diverse populations, such as those within the community at high risk of poor health and social outcomes, people being discharged from hospital, and older people living in residential care homes. Nurses must communicate many things about such as information about a patient, treatment or condition, important messages from members of the team or family members, and in many ways, in writing, such as in the form of notes, charts, tables, records, emails, etc., verbally from person to person, and also non-verbally, i.e. facial expressions, tone of voice, gestures and eye contact. Nurses must communicate with many people such as patients, family members, other nurses, doctors, support workers, social workers, physiotherapists and many more in many contexts such as hospital wards, on the phones, via technology or written information, in patients' own homes, in MDT meetings, etc. Communication can be difficult for many reasons due to internal barriers such as language differences, culture, expectations of the situation or past experience, and external barriers such as background noise, distractions, and interruptions. It's very important for nurses to work well in teams and communicate well with people from different professions, otherwise they are putting the patient's health and potentially their life at risk. Having a good relationship with the patient is important to overcome barriers. Clinical pathways, or CPWs, are tools used to guide evidence-based healthcare. Their aim is to translate clinical practice guideline recommendations into clinical processes of care within the unique culture and environment of a healthcare institution. A CPW is a structured multidisciplinary health plan. Mildred Blackster argued that although care pathways integrate and coordinate care across specialisations and promote quality and equity of treatments, they do not always enhance communication with the patient, as technologies can alienate people because they are not true to life. Shared care protocols are agreements between professionals that outline the ways of sharing responsibility for managing prescribed medications between specialists and primary care prescribers. Methods of communication are also agreed. Their aim is to avoid errors, misunderstandings, and confusion. Shared care protocols facilitate the seamless transfer of patients from secondary care to primary care in relation to their medication requirements, clearly outlining the responsibilities of the general practitioner and consultant. Clinical guidelines promote communication and shared decision making because they recommend how health professionals should care for people with certain conditions. Using common guidelines reduces the chances of different people within the multidisciplinary team to give different information to patients. The NHS England Handbook, MDT Development Working Towards an Effective Multidisciplinary Multi-Agency Team, recognised the unique position of the patient at the centre of the multidisciplinary team. The patient is empowered through good communication and encouraged to remain in control, giving the right input at the right time, coordinating and developing services within healthcare professionals to achieve the best outcomes of care. Nurses should be role models for compassion and effective communication in a multidisciplinary team. Finally, trust is the cornerstone of effective communication and relationships in healthcare. A multidisciplinary team is a group of health and care staff who are members of different organisations and professions, e.g. GPs, social workers, nurses, that work together to make decisions regarding the treatment of individual patients and service users. A multidisciplinary team may include the treating psychiatrist, the primary care physician, other medical specialists such as neurologists or the palliative care team, the home health nurse or the nursing home staff. Coordination of care between multiple providers in various fields improves patient outcomes. Gale 2018 states that multidisciplinary teams are advantageous because it gives the patient access to an entire team of experts. It improves service coordination, it expedites the referral process, it creates avenues for service implementation, it allows patients to make goals for themselves. He also said that they are disadvantageous because there is always a time pressure involved in providing services. Different team members come from unique backgrounds. It requires collaboration to be effective. It is dependent on available resources. Incomplete decisions happen without complete information. If it wasn't documented, then it didn't happen. So there have been many recent changes which have impacted the roles and responsibilities of the registered nurse. The Nursing and Midwifery Council regulates, supports and influences nurses. The code sets out common standards of conduct and behaviour for those on the register. There are 4 main principles: prioritise people, practice effectively, preserve safety, and practice professionalism and trust. Effective communication is essential to the functioning of multidisciplinary teams, and there are both advantages and disadvantages to multidisciplinary teams. That's the end of my presentation. Thank you for watching.